Heart disease continues to be the leading cause of death across the globe, and among its most dangerous consequences is the heart attack. For many people, the idea of a heart attack is tied to dramatic scenes in movies, sudden clutching of the chest, collapsing to the ground, and immediate crisis. While this can happen, the truth is that heart attacks often develop in more subtle ways, sometimes hours or even days before the actual event. What makes them so dangerous is not just the severity of the condition, but the fact that many people either ignore or misinterpret the early signs. Understanding what a heart attack really is, what causes it, and how to recognize it can save lives. At its core, a heart attack, also called a myocardial infarction, occurs when blood flow to a section of the heart muscle is blocked. The heart, like every other organ in the body, relies on a constant supply of oxygen-rich blood to function. This blood is delivered through vessels called the coronary arteries. When these arteries become blocked, the part of the heart muscle that depends on them begins to suffer damage from lack of oxygen. The longer this blockage continues, the greater the injury, and if not treated quickly, the muscle cells begin to die permanently. The most common reason for this blockage is the buildup of plaque inside the arteries. Plaque is a mixture of cholesterol, fat, calcium, and other substances that slowly accumulate over years, a process known as atherosclerosis. At first, plaques may not cause any obvious symptoms, but as they grow, they narrow the arteries and make blood flow more difficult. Sometimes one of these plaques suddenly ruptures, creating a wound inside the artery. The body tries to repair this wound by forming a blood clot. While this clot is meant to heal, it can completely block blood flow, and in that moment, a heart attack begins. Other less common causes include severe spasms of the coronary arteries, which temporarily shut down blood flow, or even tears in the artery wall. Regardless of the exact cause, the result is the same. The heart muscle is deprived of oxygen and nutrients. Without quick treatment, not only does the muscle become damaged, but the entire rhythm and pumping function of the heart may be disrupted, sometimes leading to sudden cardiac arrest. Knowing the symptoms is critical because time truly equals muscle when it comes to the heart. The sooner treatment begins, the more heart tissue can be saved. The classic symptom, and still the most common, is chest pain or discomfort. People often describe it as pressure, heaviness, squeezing, or a feeling that something heavy is sitting on their chest. But this discomfort does not always stay in the chest. It can spread to the shoulders, arms, back, neck, jaw, or even the upper stomach. Other important symptoms include shortness of breath, nausea, vomiting, sudden sweating, dizziness, or lightheadedness. Some people notice their heart racing, beating irregularly, or feeling weak. In many cases, these symptoms appear gradually and may even come and go, leading some to dismiss them as indigestion or stress. This delay can be deadly. It is also important to recognize that not all heart attacks look the same, especially between men and women. Men are more likely to experience the classic chest pressure that radiates down the arm. Women, on the other hand, often experience less typical symptoms such as unusual fatigue, trouble sleeping, shortness of breath, indigestion-like pain, or discomfort in the back, shoulders, or jaw. Because these symptoms are less dramatic, they are more likely to be ignored, leading to dangerous delays in treatment. This overlap with other conditions makes things even more confusing. One of the most common points of confusion is distinguishing a heart attack from heartburn. Both can cause discomfort in the chest, but there are important differences. Heart attack pain is usually described as heavy, crushing, or squeezing, and may radiate to other parts of the body. It is often accompanied by sweating, nausea, or difficulty breathing, and it does not go away with rest or antacids. Heartburn, by contrast, often produces a burning sensation that rises from the stomach toward the throat and typically improves with antacids or changes in body position. Yet, because symptoms can overlap, doctors emphasize this rule. When in doubt, treat chest pain as a possible heart attack until proven otherwise. Another critical point is that heart attacks are not always sudden. In many people, there are warning signs in the days or weeks leading up to the event. Episodes of chest discomfort during physical activity that go away with rest, a condition known as angina, can be an early red flag. Fatigue, shortness of breath, or new patterns of indigestion may also signal that something is wrong. Listening to these signals and seeking medical advice early can prevent a future emergency. So, what should you do if you or someone nearby might be having a heart attack? The most important step is to call emergency services immediately. Do not try to drive yourself to the hospital. While waiting for help, it is best to remain calm, sit or lie down, and avoid unnecessary movement. If prescribed nitroglycerin, taking it as directed may help relieve chest discomfort. Chewing an aspirin, if available and not contraindicated by allergies or other conditions, can also help by thinning the blood and reducing clot formation. But none of these steps replace professional medical treatment, they are only supportive until help arrives. Once in the hospital, doctors use a combination of tests and treatments to confirm the diagnosis and restore blood flow. This might include medications such as clot busters, blood thinners, and pain relievers, or procedures such as angioplasty, where a balloon and stent are used to open the blocked artery. In severe cases, bypass surgery may be needed. The goal is always the same: to restore circulation as quickly as possible and save as much heart muscle as possible. Beyond emergency treatment, prevention is the most powerful tool we have. While age, sex, and family history are beyond our control, many other risk factors can be managed. High blood pressure, high cholesterol, diabetes, smoking, obesity, poor diet, and physical inactivity all increase the likelihood of coronary artery disease. The encouraging news is that lifestyle changes can dramatically lower these risks. Eating a heart-healthy diet rich in fruits, vegetables, whole grains, legumes, lean proteins, and healthy fats is one of the most effective steps you can take. Reducing salt, avoiding excessive sugar, and limiting processed foods help protect blood vessels. Regular physical activity such as brisk walking, cycling, or swimming for at least 30 minutes most days strengthens the heart and improves circulation. Quitting smoking, moderating alcohol intake, and managing stress are equally vital. For those with medical conditions such as high blood pressure or diabetes, taking prescribed medications and keeping regular checkups are essential for long-term health. The reality is that heart attacks are both a personal and a public health issue. Millions of lives are affected each year, yet many of these events are preventable with the right awareness and choices. The key message is simple: never ignore chest pain or unexplained symptoms, no matter how mild they seem. Seeking medical help quickly can mean the difference between life and death, between a full recovery and lifelong complications.